If you've watched any amount of television recently, you have been bombarded with commercials with old football players and retired actors who are telling you about all the changes to Medicare, and they're telling you how you can get all these different benefits like dental, vision, and hearing. They're talking about Medicare Advantage, and so are we today. We're going to talk about how Medicare Advantage plans work, what they cover, and if they're a good fit for you. Hey, thanks for joining us today for Medicare 101. Hey, welcome back. Today we're talking about Medicare Advantage plans, what they are and how they work. If you have been watching any amount of television, you have been seeing all these ads about changes in Medicare and all these extra benefits like dental, vision, and hearing that you can get. Folks, they're talking about Medicare Advantage, and Medicare Advantage is an advantage over original Medicare. We're going to talk about just how they work and how to choose the right Medicare Advantage plan if you decide to go with one. If you remember from our previous videos, we've talked about how Medicare Parts A and B works. Original Medicare has no limit on the cost sharing that can come your way. Remember we said that original Medicare from 1965 until today has never covered 100% of your medical cost. And there's no limit on how much can come your way. Medicare gives you a couple of big options on how you can offset and protect yourself from your healthcare cost. Option one is to have your original Medicare, and alongside that to have a Medicare supplement plan. And then you would probably need a Part D plan to go along with that as well. So Medicare, Medicare supplement, and a Part D plan. About 3 different plans that you would be looking at to have your medical coverage if you're on original Medicare. The other option is completely different. This is what is known as Medicare Part C or Medicare Advantage. Both of those mean exactly the same thing. And basically, Medicare Advantage is just simply your original Medicare through a private health insurance company. So a Medicare Advantage plan is a health insurance plan that is contracted with Medicare to offer you your Medicare benefits. They must offer all the same coverage that original Medicare does, but they often offer some additional benefits that original Medicare does not. So there can be some significant advantages to having a Medicare Advantage plan. Now, when you're on a Medicare Advantage plan, you still have original Medicare, but original Medicare takes a back seat. The only job that Medicare has at that moment when you're on a Medicare Advantage plan is to pay that insurance company a monthly premium to take care of you. Generally, that's the average cost that it takes Medicare to take care of a Medicare beneficiary in your area. So they'll pay that to the insurance company every month, and then the company is the one who is actually responsible for taking care of you, and they're the ones who set up all the billing and work with the hospitals and all that. So your original Medicare is in the back seat, your Medicare Advantage is in the driver's seat at that point. Now, there are some advantages to having a Medicare Advantage plan. One is you can usually get Medicare Advantage plans for low or even no additional premium. Now, because you're still on Medicare, you still have your Medicare Part B premium. So you get to pay that each and every month while you're on the Medicare Advantage plan. But oftentimes, you can get the Advantage plan for very little or even no additional cost. The second is that you have a safety net. Unlike original Medicare, remember original Medicare has no limit on the cost share. If you have chemotherapy and you're on original Medicare, you're paying 20% of that chemotherapy, and that unlimited amount of 20% is coming your way. However, every single Medicare Advantage plan must have a maximum out-of-pocket. It's a safety net. It's designed to help prevent a health crisis from becoming a financial crisis. So if you have that same chemotherapy event, Medicare sets the maximum out-of-pocket for any Medicare Advantage plan at no more than $7,550. Now, a lot of plans have lower than that. It really depends on what area you live in, so that's going to vary. But it can't be any more than $7,550 in a calendar year. So that means that if you have $100,000 worth of chemo and you're on original Medicare, you could get billed for $20,000. If you're on a Medicare Advantage plan, however, and your maximum out-of-pocket is actually the maximum, once your chemotherapy charges, your share hits $7,550, you're not paying any more for the rest of the year. The company that you're with will pay 100% of the costs beyond that. That is huge because that helps to keep you from falling off into the bottomless pit of a financial crisis like you could with Original Medicare. Third reason to go with the Medicare Advantage plan is usually you have some lower cost. So remember, on Original Medicare, if you go to the doctor, you have a $203 annual deductible, and then you're paying 20% on top of that. If your Medicare Advantage plan has a $0 copay for a primary care visit, you pay $0. So all the 20% and all the Part A deductibles and coinsurance that you would have with Original Medicare goes away whenever you sign up for a Medicare Advantage plan. And whatever the Medicare Advantage plan has as its copays is exactly what you would pay when you have those services done. So if it's $50 to go see a specialist, it's $50. There's no 20%. If it's $300 per day to stay in a hospital as an inpatient, it's $300 per day, not the $1,484 followed by the $371 and all that you would have under the Part A coverage. So if you've had a group plan or an individual health insurance plan, you're already familiar with how this works. You can see that you have a $25 copay for whatever service, and that's what you pay. That's how Medicare Advantage plan works, and many times the cost that you're going to pay on a Medicare Advantage plan would be lower than what you would pay on Original Medicare. The fourth advantage to a Medicare Advantage plan is that you can get some additional services that Original Medicare doesn't cover. Remember when we talked about Part A and Part B? There was no mention in there about routine dental, routine vision, or routine hearing. Original Medicare does not cover that. So if your vision is going bad and you need to get some new glasses, Medicare is not going to pay for that. And if you go the option of having Original Medicare and a Medicare supplement, your Medicare supplement is not going to pay for glasses either. Medicare supplements only pick up what Medicare pays and has left over. They don't add benefits generally. On a Medicare Advantage plan, however, they can have some of those benefits. And again, those are going to vary from area to area. They're kind of county specific on what kind of benefits that they offer. But an Advantage plan can offer some of those additional services like routine dental, routine vision, routine hearing, over-the-counter bits, maybe even gym memberships and things like that to help enhance your health care and your health coverage while you're on the Advantage plan. So those are some significant reasons to consider an Advantage plan. Now, there are a couple of things to be aware of about an Advantage plan that are different from Original Medicare. Number one is that Advantage plans come in different flavors, just like your individual or group plans do. You probably have heard terms like PPO plans and HMO plans and so forth. Medicare Advantage plan comes in those kind of flavors along with a few others. But typically what that means is that plans are going to have networks, doctors that they play well with, and then there's going to be doctors that either they don't play well with or don't play with at all. So on an HMO plan, you can only use doctors that are in the plan's network. With a PPO plan, you get a better price when you go to doctors that are in the network, but you can still see out-of-network doctors if they'll accept the plan. You just might pay a higher price when you do. So understand that on a Medicare Advantage plan, just like on a group plan or individual plan that you may have right now, there could be network considerations. The second thing to be aware of is that unlike Original Medicare, there can be prior authorizations. What that means is if your doctor says, hey, you need to go get an MRI, the insurance company could push back on that and say, hey, we haven't even tried an X-ray yet. An X-ray would be cheaper. And that prior authorization is designed to help save you money, and it's designed, quite frankly, to help save them money. And so that could be a consideration in there. So as you're kind of thinking about, do I need to go with an Advantage plan or with Original Medicare and a Medicare supplement? For some people, that is an important consideration because if you're on Original Medicare and you have a Medicare supplement, there are no networks. Any doctor that accepts Medicare will accept your Medicare supplement, and there are no prior authorizations on Original Medicare or your Medicare supplement. So that means that if your doctor says go get an MRI and you've got Original Medicare and a Medicare supplement, you go get an MRI. Medicare is going to pay and the Medicare supplement is going to pay their part. So that's just part of the consideration factor there as you're thinking about and weighing out which is more important for me. So just a few things to be aware of with a Medicare Advantage plan is number one, the coverage is going to vary from area to area. So you can only get a plan that's available in your county or zip code. And what you have available to you could be different than what's available in the adjacent county. And so we want to be careful to make sure that you're getting matched up and lined up with the right one. It's entirely possible for you to hear advertisements for Medicare Advantage plans that are not even available in your area. So that's just a caution there. Now, in order to enroll in a Medicare Advantage plan, you must be in Medicare A and B. So you have to have both parts of Original Medicare in order to get signed up for a Medicare Advantage plan. However, once you're on a Medicare Advantage plan, you do have the convenience of one single plan. So your Medicare Advantage card is your one-stop card. It's the one that you would take to your doctor, to the hospital, to the pharmacy, maybe even to the eye doctor or the gym. So you got the convenience of just one card. If you're on Original Medicare and a Medicare supplement, you've got your Medicare card, your supplement card, you've got your Part D prescription card, and you may even have a dental, vision, and hearing plan because you want that coverage as well, and Original Medicare doesn't cover that. The Medicare Advantage side, you got it all in one card, and you take that one card everywhere. Now, coverage could be limited to a specific service area when you're on a Medicare Advantage plan. And that's one of the considerations that you want to look at. Are you planning on traveling? Are you going to be snowbirding? Now, on all the Medicare Advantage plans, if you do take like a vacation and you travel somewhere, they're going to have nationwide coverage for your ER and urgent care visit. And so you don't need to be worried about that kind of network issue. In fact, a lot of them are going to have your ER and urgent care coverage even if you're traveling worldwide. So a Medicare Advantage plan isn't going to limit you if you're taking vacations. However, if you're planning on snowbirding and you're going to have other doctors set up where you're staying 5 months out of the year at that location so that you can be closer to the grandkids or closer to the beach when it's cold where you are, then that could be a consideration. Just understand that some plans may have a nationwide network. So it's not to say that if you're snowbirding, you can't have a Medicare Advantage. You just want to make sure that you've got the right one that's going to cover doctors where you are. So be aware of that and just have that conversation with us if you're planning on doing some traveling, particularly for long-term type travel. Now, plan premiums, benefits, all that can change from year to year. Every year, Medicare gives the companies an opportunity to update and maybe upgrade or change or alter their benefits. And so it's good to take advantage of the annual enrollment period to make sure, number one, if your plan has prescription coverage, that your plan is still going to have the best coverage for your medication. And then you want to make sure that maybe some of the other plans in the area may not have better coverage on some of the things that you might need. There are no health questions on a Medicare Advantage plan. So you can change those from year to year with absolutely no issue. And there's no issues with prior or pre-existing conditions. So that if you sign up for a plan in the annual enrollment period in December and your plan starts in January, it doesn't matter if you've got stage 4 cancer and you've got open heart surgery scheduled for January 2nd, you're going to be covered as though you had been all those years before. But it is good to take advantage of that annual enrollment period just to make sure that your plan is still going to be the right fit for you for the upcoming year. And then you may or may not be required to see doctors in the network. And again, that goes back to what flavor plan that you have. And part of the way that we help you select the right plan is to make sure that your doctors are in the network. We'd rather you change the plan than have to change the network or change the doctor that you're seeing if at all possible. So, how do you choose the right plan? Well, typically, we're going to start with your medications. Because if you need Part D coverage and you're looking for a Medicare Advantage plan that has the Part D coverage in there, that can be one of the big variables. We understand that medication costs can be one of your biggest ongoing medical expenses throughout the year. And so we want to make sure that number one, your plan covers all of your medications, and number two, it's going to cover them for the lowest cost. The second thing we want to do is make sure that the doctors that you are seeing play nice with the plan, that they're in the plan's network. Again, we want to make sure that you are minimizing the amount of change that you need to make in order to get the health care that you need. You probably have a good, long-standing relationship with your doctor, and we'd rather not monkey with that. And that is one of the important things that we look at. We do not assume doctors are in network. We check. We see too many times when people call 800 numbers, they're told that their doctor's in the network. They go to the doctor and the doctor says, we don't accept this plan. And so that's just one of the important considerations there. Then once we see if there's a couple of plans that might be in the lower cost category for you, and we're still trying to figure out which one is going to be the right fit for you, we might ask, is it important for you in that coming year that you might need glasses? You might be needing hearing aids because your spouse is saying, you're saying too much, or whatever the case might be. Or maybe it's finally time to get those dentures so you can enjoy eating food again. Whichever case it is, we're going to try to find out which plan might have the best coverage for that situation. And then we want to enroll during a valid enrollment period. You cannot enroll throughout the year unless it's your initial enrollment period. So the time frame that you're first turning 65, you got that 7-month window that centers on the month that you're turning 65. So let's say you're turning 65 in July. That means you have all the way from April 1st to October 31st to get signed up for a Medicare Advantage plan. If you're retiring, you've been working past age 65 and you're now moving off of group benefits, you have a 63-day window that you could get signed up for a Medicare Advantage plan. And then throughout the year, in the annual enrollment period from October 15th to December 7th, every year, Medicare gives you an opportunity to sign up or to change your Medicare Advantage plan and get set up with the right benefits for you at that point. Hey, we're here to help you with that, and we want to try to find out which plan is the right one for you. We are not married to any insurance company. That means we are free to look and see which company has the right plan for your situation. If you'd like to explore Medicare Advantage plans a little bit more, find out what the benefits really are, what they would mean for your situation, how you might be able to get the most out of Medicare, give us a call. You see our number here, or you can visit our website, and we'd be glad to help you out. There is never, ever any cost for our services at any point, and there's no obligation. So if you'd just like to have a free analysis done of your situation, find out what might be a good fit for you, contact us. We'll be glad to help you out. Hey, thanks for watching today. Stay tuned for our next section where we're talking about Medicare supplements.